Well, greetings again from Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you this morning about correcting a badly developed case of dental arches. This young lady probably had several functional problems like poorly breathing through the mouth, also tongue thrust, and different things would cause the arches to not develop properly. And one of the main things is that children don't nurse long enough to really develop the arches before they stop nursing. It's something that we can't do in this country, but I've seen was in an African school when none of the kids had this problem, but they all have to nurse till they're about 2 years old or 2.5, and they will not have this type of problem. Let's get into this now, and I'll try to do it right quick and show you there are several ways to enlarge the dental arch. Let me get this going here. This is a poor picture of this young lady, but we have some better pictures of the mouth. Now, the arches here are obviously undeveloped, and you look at them from any direction. The tongue is just not in there pushing out on this, so she has to be breathing through the mouth, even though you don't look like you're doing that. There's a lot of allergies that children have, and they have to breathe through their mouth instead of breathing through the nose. And if you breathe through the mouth, your tongue is not in the right position. And there usually you breathe over the top of it. Sometimes you hold the tongue and breathe around the side. There are different ways, but the tongue is not in the correct position while the person breathes like that. So we're going to go ahead and on the right side of the mouth now you can see the development is kind of sucked in this area of the mouth right here. It's just not developed out to the side like it would do if the tongue was in there. And when we look at this in a few minutes from the top, you can see this even more. Now, we did this case a long time ago, but the same thing. I mean, we may be wrong in a lot of ways, but you can develop an arch with a whole bunch of different ways. Just in a young child, just an arch wire, but put the buccal root torque. As you bring these molars out to the side, you need to bring their roots with them, and that's where you develop the root, the airway space to help this child start breathing correctly. And you need to do everything you can on the kids. Sometimes we send them to an ENT person to see if this is an allergy or if this is some obstruction in the nose, the turbinates, or the deviated septum, and different things that people can have that cause them to breathe through the mouth. But let's get a better look at this, and we'll see, and I'll show you what we did. We didn't, I think we encouraged this child to breathe through their nose, and you got to get them to do that. That's something you just keep talking to them about it, and their parents, so they'll help them. But don't try to get them to breathe through the nose. If there's some obstruction there, they can't get air through there. Now, a lot of times I would send a person to an ENT person, or maybe somebody to encourage them. They'd spray a little nasal spray in there to shrink the tissue, and then they could breathe well. They say, well, there's nothing wrong. Well, there is something wrong, or they wouldn't be shaped like this. Now, So you have to get the person correct their airway, and then you can correct this problem, and the retention of it is no problem. But if you don't correct the problem, you're going to try to develop, or this is going to collapse to some extent on you. Now look at the width of this. Look at the way the turbinates in the mouth up here. They're just not formed like a tongue would form this like this. It's just obvious to see what's the problem, and you don't have to be a brain surgeon to know what you want to do here. You just want to widen this thing out and get this child functioning properly. But don't try to get them to breathe properly unless you've checked out their nasal cavity. They don't have something wrong up there. Find out what really caused it, and that's the best thing you can do for them, and correct it and straighten it out. So what we did here, we just used arch wires to do this with. Now on the bottom, it's narrow too. A lot of times we'll find them with wide lower arches and narrow upper arches, and they'll have cross bites in there a lot of times where they keep the tongue in the bottom arch. Sometimes they keep the tongue kind of in between and swallow, and both arches will be kind of caved in, and that's what has happened in this particular case now. Then we look at it, we went in early. You could wait on this, but this was back in the 70s. If you wait till they're 12 or 14 or something, they get all these teeth in there, they got a bigger problem than you do if you can do it kind of early. So this is a case where we use these little step down arches, and you drop it down like this and come in here. Now with this step down arch, you can expand it or retract the arch, however you want to do it. Now we use the double brackets here, which we don't recommend. It's the single brackets what I recommend, but this case was done in the early 70s, and but the principles and everything are the same. I mean, you may learn that other things are wrong, but these principles are the same. I don't care how old you go in, how many years you wait coming in here. Let's take a look now from the other side. Now we drop these arches down, and they look like you come in with this. You got to keep. It's harder to bend these than you think. You want them just barely touching over here and not touching back here on the gum tissue. And sometimes you have to maneuver this around and try it in and pull it up. Sometimes you can have this intruding the teeth, or you can have it extruding the anterior teeth and line them up. So this is after we had worked on it a while here before we got to this point. We put those in step down arches in there, and both of them, and they seem to be to just bring it just right. You don't have to go this far down if you want to cut across along here. Sometimes it's easier to keep away from the tissue, and you'll be tight here and loose back at the back, but work on that. It's harder to bend those than you think. Let me just show you another little thing about the step down arches. I'm going to just make a white screen here. You can take a step down arch and come along like this, come back up and go over here. And you put it between two groups of teeth in here. You can expand with this arch. You would come in here and you would have to drop this down like this. It would be normally this way, but you would have to squeeze this over and come across, maybe not this much. Now you put this between the teeth, but it's actually wanting to be straight up and down like this. So it expands the teeth. Now when, well, this arch would come on around on the other side, and you'd have a similar thing over on the other side. Now when you squeeze this together up here, the bottom part curls out like this. In other words, it'll twist out this way. Now as this pushes the tooth away, as it gets the tooth out like this, it actually, when you first engage this into the bracket, it tends to move the root of the tooth in this direction. The roots of the teeth will move the way you're expanding. And when it gets up here, the tooth will be straight up and down. And if you constrict an arch like this, you come in here and you drop it down and you come over and you move it up like this, and you're going to squeeze the arch together more. Then you take this and pull it back like this, and you can, as you stretch it this way, as you go in this direction, the bottom part of this goes up like that, and that changes this, and so it pulls the roots in the direction that the crown is moving. So there's more to this step-down arch than you think. So we'll get back to this. I didn't mean to spend a lot of time on the step-down arch, but it is a good arch to use, and you can use it in a lot of different ways. On the lower arch, you don't hit it. If you just run straight across here while we're waiting on these teeth to erupt, you'll bite on this and bend it, so you have to drop it down and do that. You can use them early while the developing teeth are not in properly. So let me get rid of that. Now you can just look at this arch. Anybody can look in here and see. I mean, this is a mess. I mean, this needs to be way out like this. The tongue is not pushing on this to bring it out. So this child probably did not nurse properly. I don't know what caused it and they may have allergies and they may have a lot of different things, but there's a functional problem here, and you need to get at the problem. If you can solve that, the retention of the case will not be any problem at all. But if you don't, it's going to be a constant retention problem for as long as a person is doing the thing that's wrong in here. So you have to develop that arch, and as you see how these crowns are leaning out this way already, and we got to spread them a lot further. So you're going to have to put some of this buccal root torque in the back part of the arch wire. You get it to a rectangular wire, and you have to bend this as you go back to the back. You want the wire bent out so that you have to gauge it. The arch wire is being twisted to put in there, and you twist it over, and it'll want to bring the root of the tooth out, and that's where the airway is. And so you need to use buccal root torque when you do a lot of expansion like this on there. Now let me erase that, and we'll go and you can see the lower arch is not quite so bad. The teeth are tilted out a little bit better in the molar area, and you're not any big problem there, so we'll go ahead. Now with the upper, your teeth are tilted the wrong way. I mean, you can see this tooth is not, the lingual cusp are down lower than the buccal cusp, so you know they're this way. You want those teeth to come out like this, back in the back of the mouth. And so you're going to have to take your arch wire where it goes across like this and bring it, so you'll have to twist it and put it in there, and it'll bring it out this way. If you put buccal root torque and the wire is not strong enough, the torque is better, it'll push it over. So sometimes we on an older person, we'd use a Big Daddy wire with also put the buccal root torque in. Or if you want to put a palatal separator, that's rigid. Don't have one of these palatal separators that's wound, it's soldered at the molar, and you have just a bar across these teeth, because that doesn't bring the roots out. And that's the kind people are making, and that is a big mistake. They need to be, every tooth should have a band on it, and it should be rigid in there, so you go apart with it. If the teeth are tilted like this, and you go apart, you come out, it'll put some bend on it, but you leave it in there for a few months, and it works its way out. And the palatal separator, if the teeth are cemented and solid in there, it will bring the bicuspids and the molar out, and you can carry your second molar will usually follow enough. We rarely ever bend the second molar and put the palatal separator, but I can put it on the bicuspids and the molars, and this part is soldered in there, and it brings those teeth out. It brings the roots of the teeth out with it. So that's, but on a young child, you can do it sometimes with just a rectangular arch wire with a lot of expansion in it. And that's what we apparently did here. Now this is the step-down arch, and now we're letting these teeth erupt into the mouth. This was before we had brackets good. This was back in 73 or 4, somewhere like that, before we had the brackets. Brackets are far better to use than the bands, except we band the molars so we have something on the lingual side also. And we got 2 or 3 slots back in here, at least 2 slots on the lowers. We're putting the lip bumpers and different things in addition to your arch wire, intruding wires also. So let's go now and see the next deal. All right, here's we banded everything in here. Now with bands, you have to put more torque than you really think you want and finish it, because when you close, you got 2 layers of metal and 2 layers of cement in here. You will have to close that space, and it'll reduce the space, and it'll reduce the torque that you have in your front teeth out here. Bands are not near as good as brackets, but we do use bands on the second, the 6-year molars, and nearly always on the second molar, but you can put a bracket back on the second molar if you like. All right, here the step-down arch is, and now we develop that out, and we're going to bend these wires out and bring these teeth out like that. And we want to correct what caused this to do this to start with. Find out what it is if it's possible. And if you don't find it out, you got to take retention for years, maybe the rest of their life, really. All right, we're like that, and we're coming. Now we've spread that out. Now we've banded all the teeth, and we'll have to expand it a little past what we really want after we finish. Now there's a lot of difference in this. We still have got to go out a ways like that. And you can put your buccal root torque in this wire right here by just twisting the wire at the end of back here, and it'll be a progressive torque coming back more on the molars and less on the bias and everything, but it'll bring all the teeth out like that. And now we do some of that on the bottom. The bottom didn't need as much of it, but we're lined up better. Now here we are. This is 1997. I forget just exactly, but we were working on this child in the 1970s. Now the wisdom teeth, or the second molars, now you have to watch your second molar will get caught on here. You have to put a separator in here, push this tooth back, or else come in and have an upright spring if it's real bad. but it slips past here, and this one comes down to, and you don't have any wisdom teeth that I see in this particular case, and we'll show you the wisdom, the second molar makes it in there. You can see now you can take the bracket band off, and a lot of times the tooth will come on in, or put a separator in there and push this tooth back just a little bit, then leave it in about a week or two, and then take it out, and this will come on by that and come in. So it's coming in. This is 1975, and this must be February of 75, and this is finished out pretty good now. Everything's working pretty good. So here we went from that to that, and from this to this, and from this to that. And the palette was like that. Now it's like that. Of course, that's a bigger picture, but if I go back here and show you that, and now it's much bigger. This is straightened out some, and the tongue is flattening this out a good bit. I really think we are really needed more buccal root torque here, because you see lingual cusp are lower back here. They should bring ball out even further than that right there, but that's pretty good. And we'll go back and look at it, look the way it was, and here's the way we finished it out. And we put a retainer in there, and we eat on that. A lot of times if they're chewed properly, there'll be more force here, and that'll kind of make that tooth rotate a little bit to bring your cusp out if they start functioning correctly. So this is not the finished picture. This is when we started the young lady, but she had a breathing problem, and we can work on getting function corrected. And then you do your teeth. Your retention problem is not anything like as bad as it is if you haven't corrected the functional problem, whatever it is. So I'm going to say goodbye, and thanks for watching. And I'll close this out, and I want you to subscribe to our channel. We appreciate your work, and drop me a line in here. If you have any questions, we'll try to answer them. So I'm going to stop right here.